Possible breakthrough in the treatment of COVID. Pharmaceutical company Merck is reporting promising results with the experimental COVID-19 drug molnupiravir. The drug company looked at 775 adults with mild to moderate COVID-19 at high risk for severe disease. The patients who received the antiviral pill took it within 5 days of symptoms.
They were given twice a day molnupiravir and dramatically, by 50%, reduced hospitalization and death. So an oral pill that works against COVID-19 hospitalization.
Well, an independent group of experts recommended to stop Merck's trial because the results are so favorable. The company says it plans to submit its data for FDA review in the coming days. Joining us live now is Stanford infectious disease doctor Upi Singh. Doctor, thank you so much for joining us.
My pleasure.
So how big a deal is this antiviral pill? And if it's cleared, how soon could it be actually rolled out to the public?
Yeah, so I think this is really good news, and I think it is a really big deal. So as was outlined, this is an oral medication. You don't need to be admitted to the hospital and need an IV. This can be given to people for 5 days, and it reduced the risk of hospitalization and death by half. That's quite substantial, and I think it really is going to be an additional item that we have in our armamentarium to prevent ongoing outbreaks.
Now, who will benefit the most by taking this drug? Will it be people that are at risk for severe disease, or is this something that if you contract COVID, you automatically get this drug?
Yeah, great question. So the study was done for people who had at least one risk factor for severe disease. So diabetes, older age, obesity, for example. That's in whom the study was done. I think that the results are really promising, and I think it'll be for the FDA to decide whether those results can be leveraged to the general population or not. So we'll have to wait and see what the FDA says. But the great news was that it was a safe drug, was well tolerated, which I think is another important criteria.
Oh, wonderful news. Today, Governor Newsom announced California students will have to get vaccinated against COVID in order to attend in-person learning. Do you think this is the right move to focus on children as opposed to getting the first shot in people who are still holding out?
I think we are going to have to take multiple prongs against this pandemic, right? We've been living with this for 18 months. We have a fantastic vaccine that is safe, that is effective in adults, and we need to keep encouraging people who have chosen not to get vaccinated. I also think, schools are where the most mixing and matching happens with kids, and then those kids who are not vaccinated come back home and can expose family members. So I think we want to take a multi-pronged approach. Once it's been shown that the vaccine is safe for kids 5 to 11, I would encourage those parents to talk to their physicians and encourage them to really strongly consider the vaccine. My kids are older, but if I had a child that age, I would definitely give it.
Well, let's talk about the younger kids. They're not eligible to get the vaccine just yet, but do you have a timeline when the vaccine will finally be approved for children 5 to 11?
There's a lot of chatter about this, and I think right now what I'm hearing is around November. I think the most important thing is for the FDA to do this and review all the results so that we can all feel very confident in their recommendations. So what we're hearing is somewhere around November. So not quite yet, but hopefully before Thanksgiving.
A lot of good news to report this evening. All right, Dr. Singh, thank you so much for joining us.
My pleasure.